Hello everyone, and welcome to the 4th episode of my Movember Health Tips series. If this is your first time tuning in, then please check out the previous episodes uploaded across my social media platforms, where I've covered various topics in regards to the disparity in men's health. Today we're going to discuss what some call the spectrum of type 2 diabetes. I agree with this phrase because you'll learn the development of this condition is usually a gradual and continuous breakdown of the body's ability to process energy in the form of blood sugar, more accurately glucose. This spectrum starts with impaired glucose tolerance and insulin resistance and eventually can lead to prediabetes and even spill over into diabetic ranges over time. Statistics show that over 30 million Americans, that's 1 in 10, suffer from diabetes. Between 90 and 95% of those have type 2 diabetes. When you look at prediabetes, the numbers are even more staggering. Approximately 84 million American adults, that's 1 in 3, have prediabetes, and an estimated 90% of those people have no idea they have it. When you add up the numbers, over 100 million U.S. adults are on the diabetes spectrum, meaning they have clinical diabetes or are in pre-diabetic ranges. That is 45% of U.S. adults, almost half, meet these criteria. The risk of death of those with diabetes is increased by 50% compared to those without. Having diabetes greatly increases your risk of blindness, kidney failure, heart disease and stroke, or even loss of your extremities to amputation. Symptoms of those developing type 2 diabetes often go unnoticed and can develop gradually over many years. I've personally discovered many unknowing diabetics in my practice who felt they were fine. However, some symptoms associated with diabetes are frequent urination, excessive thirst and hunger, loss of weight without effort, numbness in the hands or feet, fatigue, dry skin, poor wound healing, among many other things. So many of these signs are usually ignored until a blood test reveals the reason why. Here is a table showing widely accepted criteria to meet the clinical diagnosis of diabetes or prediabetes. I highly recommend that you check in with your primary care provider to undergo testing to see where you are on this chart. Look, discussing how the nation has gotten to this point is far too long for this video. But we can quickly discuss how you can halt this process and move back towards the normal end of the spectrum. Eating healthy, being active, and losing weight are all effective strategies to prevent diabetes or control it once diagnosed. Please discuss these strategies with your health provider to get on the right track. Everyone, this disease is killing us slowly. We have made some big advancements in medical therapy to help control this, but quite frankly, we should do everything in our power to prevent from getting here in the first place. We shouldn't only do this for ourselves, but for our loved ones. If you have found this information enlightening and think that it could help someone you love initiate steps towards improving their health, then please share. You could help someone you care about from dying too young. Again, thank you for your time and support.